Dear colleagues, today we will discuss the concept of medical and pharmaceutical law as an integrated approach to the legal regulation of healthcare and the circulation of medicinal products. Why does this topic, in our opinion, become particularly relevant? Because modern medicine is impossible without pharmacotherapy, and the pharmaceutical sector cannot exist without clinical decisions, prescriptions, protocols, safety monitoring, and quality control. At the center of this intersection is the patient, their rights, safety, and access to effective treatment. The goal of the lecture is to explain the essence of the concept of medical and pharmaceutical law, define its key principles, and analyze the advantages and risks of combining medical and pharmaceutical law into a single field. Definition and subject of regulation. Medical law traditionally focuses on legal relations in the process of providing medical care. Patients' rights, the duties of medical professionals, treatment standards, informed consent, medical confidentiality, liability for harm, and the quality of medical services. Pharmaceutical law covers the regulation of the entire life cycle of a medicinal product: development, clinical trials, registration, manufacturing, distribution, dispensing, advertising, pharmacovigilance, quality control, pricing, and reimbursement. Medical and pharmaceutical law suggests viewing these areas not as parallel, but as a single system in which the clinical decision of the doctor is connected to the availability and quality of medicines, prescription and dispensing, and the continuation of treatment. An error can occur at any point in the chain: diagnosis, prescription, procurement, availability, dispensing, use, or monitoring of side effects. This is a complex field where the object of regulation is patient safety and proper treatment, not just a service or a product. Key principles of medical and pharmaceutical law. Let us consider the principles that shape the logic of an integrated approach. First, patient-centeredness and the priority of patient safety. All legal decisions are evaluated through the lens of reducing harm and risks, from informed consent to pharmacovigilance. Second, the unity of the chain of medical care and pharmacotherapy. Treatment is a process in which the doctor and pharmacist are partners in ensuring the effectiveness and safety of therapy. Third, evidence-based practice and standardization. Clinical protocols, formularies, guidelines, quality requirements, GMP, GDP, pharmacovigilance, all of these must be coordinated through legal mechanisms. Fourth, the balance of interests. Accessibility versus safety versus economic sustainability. The law must maintain a balance between rapid access to treatment, quality control, and the capabilities of the financing system. Fifth, transparency and anti-corruption. Procurement, interaction with manufacturers, conflicts of interest, marketing practices. This is a key risk area where an integrated legal sector can establish clear rules of the game. Sixth, proper legal responsibility and fair distribution of risks. Responsibility should correspond to the actual contribution to the risk. The doctor is responsible for prescribing, the pharmacist for checking interactions and dispensing, the institution for organizing processes, the manufacturer for quality and instructions, and the state for regulatory policy. Advantages of combining medical and pharmaceutical law. Now, the most important thing: what does this combination offer? The first advantage is a more holistic model for protecting patient rights. A patient has the right not only to a medical service but to effective and safe treatment, where the medication is a key element. Integration allows this right to be protected comprehensively, from diagnosis to monitoring side effects. The second advantage is fewer gray areas between professions. One typical problem: that's not my responsibility. A doctor might say, for example, I prescribed it. After that, it's the pharmacy's responsibility. The pharmacist: I dispensed it. After that, it's the doctor's responsibility. An integrated sector establishes legal frameworks for shared responsibility and common standards of communication, especially in cases of polypharmacy, interaction risks, and medication substitutions. The third advantage is better management of the quality and safety of pharmacotherapy. In modern patient safety systems, errors often occur during transitions: discharge from the hospital, change of doctor, substitution of medications due to unavailability, or self-medication. A unified approach makes it possible to legally establish mechanisms such as medical and pharmaceutical information exchange, the medication reconciliation procedure, transparent rules for generic therapeutic substitution, and the obligation to respond to adverse reactions. The fourth advantage is a stronger anti-corruption framework. The circulation of medicinal products has traditionally been an area involving large sums of money, procurement, marketing, conflicts of interest, and incentivizing prescriptions. Integration makes it possible not to split regulation between two legal frameworks, but to see a single risk contour. The fifth advantage is more effective regulation of accessibility and reimbursement. Pricing, reimbursement, government programs, and formulary policy, all of these directly influence the physician's decisions and treatment outcomes. An integrated concept makes it possible to legitimately link clinical appropriateness with resource constraints without compromising quality standards. The sixth advantage is the creation of a unified educational and practical framework. For the training of experts, lawyers, managers, and regulators, it is useful to have a single linguistic space, terminology, principles, approaches to evidence, responsibility, and compliance. The seventh advantage is the unification of legal regulation. The merger creates a single regulatory and legal space that governs the entire healthcare sector. This makes it possible to eliminate potential contradictions between medical and pharmaceutical legislation, ensure consistency and coherence of legal norms, and simplify law enforcement for professionals. Advantage 8. Synergy of regulation. When medical and pharmaceutical law are considered as a single whole, it is easier to understand how they complement each other. For example, a doctor prescribes a medication, the pharmacist dispenses it and consults the patient. Both are responsible for the outcome. Unified law provides a clear boundary of responsibility for each party. Advantage 9. Coordination of medical and pharmaceutical activities. Medical and pharmaceutical law promotes closer cooperation between doctors and pharmacists. This is especially important when providing patients with medications, monitoring the quality of medical care, and implementing new technologies and treatment methods. Advantage 10. Simplification of the legal framework. Instead of turning to two different branches of law, practitioners and scholars have a unified system of rules that regulates their activities. This saves time and resources. Advantage 11. Increased effectiveness of oversight. Unified law allows for centralized oversight of compliance with quality standards for medicinal products, coordination of the work of regulatory bodies, and faster identification and resolution of issues in the healthcare sector. Advantage 12. International harmonization. Developed countries around the world are increasingly viewing medicine and pharmacy as a single sector. By adopting the model of medical-pharmaceutical law, Ukraine will be able to more easily harmonize its legislation with international agreements, in particular TRIPS, improve its standing in EU membership, and ensure the recognition of Ukrainian standards in the global market. Advantage 13. Integration of services. A unified legal framework makes it possible to develop new forms of medical pharmaceutical services, comprehensive medical pharmaceutical care for HIV-infected individuals, specialized programs for the treatment of complex diseases, pharmaceutical counseling services at healthcare and preventive institutions, and alternative approaches. Instead of complete unification, the following can be considered: coordinated regulation. Medical and pharmaceutical law remain separate, but are developed in a coordinated and complementary manner. This allows for the preservation of the specificity of each field, ensures consistency at the intersection of the two legal relations, and avoids the risks associated with the complete unification of medical law with the pharmaceutical section, but it also introduces increased corruption risks. Pharmaceutical law is considered either as a sub-branch of medical law or vice versa, with its own specific features and institutions. This makes it possible to maintain the unity of the principles of medical regulation, preserve flexibility for specific pharmaceutical issues, as well as the shortcomings and risks of unification. However, unification also has its complexities, and these need to be honestly acknowledged. The first drawback: the risk of excessive breadth and loss of specialization. Medical law and pharmaceutical law follow different logics. Medical law is more about the process of providing care, ethics, treatment standards, and personal data. Pharmaceutical law deals with regulation, quality, the market, production, and supply chains. When these fields are combined, there is a risk that a specialist will become a generalist but only superficially knowledgeable. The second drawback: a conflict of values. Patient rights versus market regulation. The pharmaceutical sector contains a powerful commercial component. If the balance is not properly maintained, market interests may start to disguise themselves as medical necessity, or conversely, regulation may become too strict and slow down access to innovation. The third drawback: the complexity of codification and law enforcement. A unified sector requires harmonized terminology such as patient-consumer, treatment service provision, medication product, a clear architecture of regulations, and defined boundaries of responsibility. During the transition period, this may create more disputes than it resolves. The fourth drawback: the risk of blurred responsibility. Paradoxically, shared responsibility in the absence of clear rules can turn into no one's responsibility at all. Therefore, integration must go hand in hand with a responsibility matrix and standardized procedures for interaction. The fifth drawback: resistance from professional communities. Doctors, pharmacists, lawyers, and regulators may have different views on the boundaries of their competencies. Without quality communication and education, integration will be perceived as interference in the autonomy of the profession and in established connections, which may even have signs of corruption. Conclusions. Thus, the concept of medical pharmaceutical law is an attempt to bring legal regulation in line with reality. Today, treatment is a single trajectory from the clinical decision to the safe use of medicinal products. Advantages of integration: more comprehensive patient protection, fewer gaps between professions, more effective pharmacotherapy safety, a stronger anti-corruption framework, better alignment of accessibility and quality, and a unified framework for expert training. Disadvantages and risks: possible dilution of specialization, conflict between social, medical, and market interests, complexity of codification, risk of unclaimed responsibility, and professional resistance. Thank you for your attention.